home and help prevent the spread of COVID-19. But for people experiencing homelessness, especially young people, that's not really possible. This week, a new space opened up in Ottawa for vulnerable youth between the ages of 16 and 21 who are looking to self-isolate during the pandemic. It was started by Joanne Lowe. She is the Executive Director of the Youth Services Bureau, as well as the Vice President of Mental Health and Addictions at CHEO. And she joins us on the line this morning. Hi, Joanne.
Hi, Robin.
What kinds of things have you been hearing from teens who are experiencing homelessness about what they are up against right now with this added worry about COVID-19?
Well, Robin, when for the rest of us, if we are advised or if we have the need to self-isolate in relation to this virus, COVID-19, we are advised and told by Ottawa Public Health and just about everybody else to self-isolate in their home. And unfortunately for young people, they have no home. And so we had decided that hearing from young people that the worry that if they were in need of self-isolating, that they really had nowhere to do that. For those young people who are coming to our youth shelters, and of course YSB operates the only two shelters for young people, we were beginning to get worried and hearing from young people that, could they self-isolate in their shelter? Was that reasonable? Was that doable? And while it is doable in very small numbers, we knew that we would be in a bit of a zone of problems if we had to go beyond having two young people in our shelter. And the shelter is not designed to really self-isolate. It's not a medical facility. It's not, YSB does not have medical staff on staff typically. So we were really pleased to develop in partnership with CHEO and with the help of Ottawa Inner City Health and on the advice of Ottawa Public Health that it would be better if we could find a separate space for young people to self-isolate. And so YSB had a site available, and in my dual role, both at CHEO and YSB, we were able to create the opportunity to create this space.
Can you tell us a bit more about the space? I mean, what does it look like?
So it's a residential unit that has 8 separate bedrooms. It has a common kitchen, dining room, living room. It has offices. It is on 2 floors, so it makes it easier for this kind of circumstance. When you open up an isolation center, you actually need really good advice and from medical staff. So from the IPAC team at CHEO, they came in, they looked at the space, as well as Ottawa Inner City Health, and when we started to think about this as a possibility, they came in and they looked at it, they assessed it, and they said it was absolutely doable to do it in that space.
So who are you determining then who can use it?
So as you said in your intro, it's young people between the ages of 16 and 21, which is really the common age for young people who use our shelters at YSB. And they would be young people who are either awaiting the test results for COVID-19 or for young people who are asymptomatic of COVID-19 who do not require hospitalization but do require to self-isolate. And young people can come into the center. Typically, they will be coming from our shelter. But if they contact us, and they are in need of self-isolation, then we'll work with them to get them there.
You mentioned that there are 8 separate bedrooms, but there's some shared living spaces. I mean, how is it equipped to deal with physical distancing?
Yeah, so it's a bit of a unique building. It's a round building, and so the bedrooms are all along the perimeter of the space, and then in the middle is where there would be more common space, and so we are able to exercise, and there are staff there, of course, so they can assist with that and reminding everyone, but they are able to keep 2 meters apart.
And what services will be provided by these staff to the youth?
So the team that is staffing the unit includes youth workers as well as medical staff, including nurses, and there's a physician who is affiliated with the center from CHEO. The team that's there will support the young person. If you can only imagine anyone that has to self-isolate or is awaiting whether they're awaiting results or that they are in fact testing positive, it's a major anxiety on top of the regular, which is so odd to say, but the regular anxieties that they would be experiencing because they're homeless or they're experiencing mental health issues or addictions issues. So the staff there are there to support them. In addition to that, they can access a mental health counselor from YSB. We continue to offer our services to young people and families. We're doing it through either telephone or through video conferencing, and so that those same services are still available to those young people who are there.
We know that a couple of weeks ago, the city opened up a kind of a temporary place for adults who want to self-isolate, who are in vulnerable positions. Why, Joanne, is it important to have this space for youth specifically?
That's a great question. So when the adult isolation center for homeless people was set up by Ottawa Inner City Health, it was we watched it very carefully, and very, very quickly we consulted with Ottawa Public Health and with Inner City Health to ask them, what was their best advice around young people. And very quickly, their best advice was that it would be really important for young people to have a separate space. A lot of the young people that we work with are very, very vulnerable. Most, if not all, have experienced some significant trauma in their lives. Many have had, in some cases, a lifetime relationship with child welfare. And so it was really important to create a safe space that was specific to young people. And we know that, Youth Services Bureau and CHEO have a particular expertise in working with young people.
Joanne, I mean, this actually, it sounds so needed. I wonder if this space might be able to continue beyond the pandemic.
That's a great question. That's not what our current planning is, but one of the reasons why this was made so possible so quickly is that we already had our Kids Come First health team partners in place. And so we were able to really think through quickly how we would respond to this particular need. Like everything else that's happening now, we've changed the course of how we provide services by necessity throughout all of this. And there's a lot in and among this, including the isolation center, that we will keep in mind in terms of needs going forward.
Joanne, thanks very much for the work you're doing, and it was good to talk to you this morning. Take care.
Yeah, you too. Thanks, Robin.
Joanne Lowe, Executive Director of the Youth Services Bureau and Vice President, Mental Health and Addictions at CHEO.